Hello, everyone. Welcome to the Blakley Health Innovation Series. Thank you to all of you who joined us today for this important session on mental health wellness. We bring this to you because we know how incredibly important this topic is for so many of us, and because tomorrow is Bell Let's Talk Day. So tomorrow, January 29th, is Bell Let's Talk Day, and we encourage you to be part of this movement, have the conversation, and help raise awareness about mental health. My name is Arlene Boyce, and I have the privilege of serving as Director of Development with Toronto Rehab Foundation. Our role is to raise funds to support the incredible work of Toronto Rehab in providing leading-edge rehabilitation care, research, and education. Across our 5 sites, Toronto Rehab supports the recovery, rehabilitation, and healthy return back to communities of individuals affected by aging and conditions such as brain and spinal cord injuries, heart disease, stroke, and so much more. We're also a proud member of the University Health Network, a place that is committed to advancing the vision, a healthier world. To help in this effort, Toronto Rehab is proud to bring you the series of webinars led by leading clinical and community experts to share valuable health information and to empower you with the tools and knowledge to live a healthier life. So as mentioned earlier, we're delighted to be broadcasting live from Toronto Rehab's Downtown University Centre, where we have about 75 people here in the room today and an incredible over 500 people viewing us online remotely from offices and homes across the country. So in fact, we have participants in nearly every province from British Columbia, out west and out east, all the way to Nova Scotia. We're also delighted to have some viewers join us from around the world, from the US, India, and Europe. I just want to, before we start, just do some shout outs to our friends across the country. So hello, Raymond James. Raymond James, who've come out in full force from east to west coast. We also have our friends from Medavie Blue Cross out in New Brunswick. Hello, Angela and team from Oatley-Vigman in Barrie, Ontario. The employees at City of Richmond Hill are also joining on, and so many other companies like Scotiabank, Sun Life, Wellwise by Shoppers, BMO, including our colleagues from across the University Health Network. Welcome. So before we begin today's session, I'd also like to take a moment to acknowledge our very generous sponsors who really did make this webinar series and Blakley Health Innovation Series possible. So I'd like to thank Liquorland Capital, Raymond James, let me just move this. Liquorland Capital, Raymond James, Wellwise by Shoppers Drug Mart, McLeish Orlando Lawyers, Oatley-Vigman Lawyers, 33-7, Bayer, and Scotiabank. Thank you for your generous support. So we have an incredible amount of interest in today's topic, depression, mindfulness, and self-care, which really speaks to the importance of mental health. Mental health affects Canadians of all ages and from all walks of life. In some way, 1 in 5 of us will be touched by mental illness in our lifetime. And to help us with this conversation, we're very fortunate to have with us 3 experts in the fields of psychology and mindfulness. We have Dr. Martha McKay, Angie Kingman, and Jesus Sulit. So excited to have this session, but before we start, one more thing. So this is an interactive webinar. So for all of you who are signing on and remotely, we encourage you to send in your questions. So the address to send your questions to is trf@uhn.ca, and I repeat, that's trf, as in Frank, at uhn.ca, and you'll be seeing this address along the bottom of the slides as we move along. We'll have an opportunity to answer your questions in the Q&A, question and answer period at the end of these presentations. So to help us lead the conversation on mental health is Toronto Rehab expert, Dr. Martha McKay. Dr. Martha McKay is a Toronto Rehab clinical psychologist affiliated with our spinal cord injury rehab program. Prior to joining UHN, Dr. McKay spent many years in the mood and anxiety program at the Center for Addiction and Mental Health, involved in numerous studies investigating various treatments for depression, and where she completed her doctoral research and postdoctoral fellowship. Please welcome Martha McKay.
Hello, thank you, Arlene. It is my great pleasure to be here today and to participate in this wonderful event. Let me just get myself situated here. Okay. So last year, on Bell Let's Talk Day, we had a great conversation about depression and anxiety with a focus on the science behind it. This year, we wanted to continue that conversation and expand on it to include a discussion on mindfulness practice.
Sorry, I'm just going to do this one.
Oh, what? Oh, okay. Thank you, Arlene. We wanted to expand the conversation that we were having and to include a discussion of mindfulness practice, which has shown not only to be helpful in the treatment of depression, but also has a powerful component of stress management and self-care. So my role today, starting off this wonderful event, it's a tall order. I'm going to provide a brief review of depression, what it looks like, treatment, and the role of self-care. Including some things that we learned last year as well. So why are we having this conversation about depression? It's a very important conversation to have. It is a common disorder that greatly impacts many individuals of various ages for various reasons. It has a significant impact not only on individuals' life, but also a high disease burden on a global scale. So the World Health Organization estimates that 264 million people suffer from depression worldwide. In Canada, annual rates are approximately 5%, with a lifetime rate of approximately 11%. And while many individuals experience depression, there are some who are more likely to experience depression. So we know that women are more likely to experience depression, as well as different age groups, including older adults, and youth. We've seen an increase in rates of depression for adolescents and transitional ages, which is an important treatment consideration. So, as I mentioned, there's a worldwide, there's a global scale of the burden of depression. It is a leading cause of disability worldwide, and that's true for Canada as well. It comes with significant cost to healthcare. In Ontario, it's estimated that approximately $210 million are spent on depression. But not only does it cost the healthcare system, it also can cost the individual themselves. Not all treatments that are known to be effective for depression are covered by an OHIP and come at a cost to the individual. Depression is also associated with an elevated mortality rate due to psychosocial, behavioral, and health-related determinants. But also one of the core symptoms of depression is recurrent thoughts of death and suicide, so it does come with an increase of risk for suicide. Depression often co-occurs in the context of another medical condition or illness, and here at Toronto Rehab, we do see this as well in the context of injury. So particularly with my role, we do see this in spinal cord injury. It does have a great impact on your work, your occupation. High prevalence of unemployment, disability, and absenteeism are seen amongst individuals who experience depression. There's lost productivity both in absenteeism, but also reduced productivity while you're at work due to symptoms of depression. And lost wages, the estimate costs are approximately $32.3 billion annually. So what does depression look like in individuals? So most of you know that depression comes with an emotional component. People living with depression experience persistent sadness and depressed mood. However, some may not know of the other symptoms that can occur with depression, including physical, behavioral, and cognitive. So as you know, the emotional symptoms associated with depression are persistent sadness, also loss of interest and pleasure in things that people normally enjoy, otherwise known as anhedonia. So as a result, people may stop doing things that they used to enjoy, they may withdraw socially, and even if they do participate in their usual activities, they still don't derive the same pleasure from it. Also, irritability can be seen with depression and is often noticed by others, as well as people often begin to question their self-worth and experience excessive and inappropriate guilt. Okay. So some of the physical symptoms that come with depression include sleep, appetite disturbances, fatigue. Some people experience psychomotor slowing, so they move and talk more slowly than what's normal for them. Also, the cognitive impact of depression, it comes with poor concentration and attention, can impact one's ability to make everyday decisions and also impact how you view the future, and people tend to become hopeless. So, knowing that it impacts all of these areas, the other thing that is common with depression is that the symptoms, the way they present may vary from individuals. So some symptoms can present in opposite ways. So sleep disturbances, some people may experience insomnia, or other people may oversleep, so sleeping 10 to 12 hours per night and still not feeling rested. Same thing with appetite. Some people lose their appetite, some people overeat and gain appetite or crave specific foods. Anxiety is often common with depression, and that can present in different ways. So experiencing symptoms of anxiety like worry, full-blown panic attacks, and sometimes depression coexists with another full-blown anxiety disorder, say, for example, social anxiety. So having said all of that, two individuals with depression can look quite differently. So what do we consider, what's normal sadness versus clinical depression? We all experience sadness. We're human beings. Our day-to-day isn't all rosy and happy. So how do we distinguish that? Well, what we do is we tend to look for duration, intensity, and impairment. So how are these symptoms or cluster of symptoms persisting? Do they cause interference in your everyday life? And how severe are those symptoms? So with respect to a depressive episode, in general, the diagnostic criteria would include 5 or more symptoms, one which must be depressed mood or anhedonia, with a collection of the other symptoms already mentioned: appetite, sleep disturbances, energy issues, and recurrent thoughts of suicide. In addition to that, there are different types of depression. So today we're really talking about unipolar depression, but depression also can occur in the context of bipolar disorder. It can occur with other symptoms like psychotic features. There are different types of depression dependent on cluster of different symptoms like atypical and melancholic, and it can also occur at different times and under different circumstances. There's a seasonality component to it and can occur within postpartum. What I wanted to highlight here today was that it also is it can be a recurrent disorder. So while many people may experience one episode of depression, that is not typically the course that we would normally see. It's often recurrent, and when it becomes persistent, that can lead to difficulties with respect to finding the appropriate treatment, but also a greater impact on quality of life. So, as you can imagine, knowing that depression can look differently in other people, there's different types of depression. What causes depression can't be boiled down to one single cause, and indeed that is the case. It is thought to be a complex interaction between social, psychological, and biological factors. And indeed, the search to establish the pathophysiology of depression and search for biomarkers has been quite challenging. So even though I'm glossing over this due to my time restrictions, this slide really represents decades of research looking into what causes depression. So there's various things like genetic component, the biological factors that include imbalances in brain chemistry or neurotransmitter, molecular level concerns and differences in those with depression, and also influencing other systems like the endocrine and immune system are thought to be related to the cause of depression. In addition to that, the neuroimaging studies have shown repeatedly that there are a number of different areas that show different function and structure in relation to depression. There are also psychological and emotional vulnerability to depression, so different cognitive biases or thinking patterns, There's also a component of stress. There's a strong link between stress and depression, which I'll touch on briefly. So those who have a history of trauma, childhood trauma, or experience prolonged or chronic stress or adversity, there's a link with depression as well. Depression is also related with physical illness, and again, in our context here at Toronto Rehab, we certainly see this in reaction to injuries that we treat here. Okay, so how do we treat depression? Well, there are a number of known effective treatments for depression. So one commonly known is psychotherapy or talk therapy. So that can include things like cognitive behavioral therapy, and later to include mindfulness component of that. Interpersonal therapies, behavioral therapies, and acceptance commitment therapies all have been shown to be effective treatments for depression. Certainly there are medications that are helpful in the treatment of depression that you've likely heard of. So a lot of the antidepressants, so SSRIs, SNRIs, and other strategies. In recent years, with newer treatments coming to light, things like ketamine and other treatments for depression. There are also brain stimulation therapies that are effective in treating depression. So things like repetitive transcranial magnetic stimulation, and also electroconvulsive therapy is used for the more refractory and treatment-resistant depressions. And in recent years, just even my own experience working in this area, we've seen an increase in overall health strategies, looking towards those as potential treatments for depression. We'll talk a bit about those quickly. Okay, so how do we access treatment? A good place to start in general is with your primary care physician. So that is the source of a lot of referrals to other programs and to other clinicians like psychiatrists who would be able to do an assessment and treatment recommendations and prescribe medications. Psychologists, psychotherapists, and social workers are all individuals who would provide talk therapy or psychotherapy. Again, but those individuals might be come at a cost and maybe cost prohibitive and unaffordable for some individuals. There are also hospital-based programs. Here in the GTA, we have several mood programs that offer a wide variety of different treatments, including access to treatments that are currently under research. So, in terms of, because of some of these limitations that we can see in our healthcare system, as I mentioned, there has been a shift to looking at other strategies that may be helpful in the treatment of depression. So, looking at the role of different things that are often discussed when talking about self-care. So you've likely heard of many of these strategies before, and you're probably thinking, Martha, you don't have a lot of time. Why are you talking about self-care? Well, the reason I'm talking about this is because individuals with depression, due to some of their symptoms like fatigue, loss of interest, and motivation, may not participate in some of these things like overall health strategies. But we know that they do have mood benefits, and in fact, some of them have been looked at as an intervention for depression. So for example, sleep. We all know the importance of sleep, getting enough sleep, and we know that this does have beneficial effects on mood and mood regulation, and as well as cognition, which are all obviously impacted by depression. In terms of physical activity, many investigations have studied the efficacy of things like exercise in the treatment of depression. So both cardiovascular and resistant type exercises have been shown to be effective in reducing depressive symptoms. In fact, it is included as one of the first-line treatments for mild to moderate depression in Canadian treatment guidelines for complementary treatments for depression. Indeed, yoga has also shown benefits in terms of its efficacy in treating various symptoms of depression. It's been effective in comparison to treatment as usual, with some suggestion that things like breath control and meditation are particularly beneficial. I myself has been involved in a number of yoga studies, and we've shown that it can be beneficial into other group treatments like psychoeducation. And diet. Diet has also been an area that we're all familiar that is healthy to eat a certain diet, but it also has been investigated looking at the connection with depression. So there are complications that are associated with some of the symptoms with depression, so overeating, and there is a connection between obesity and other factors like emotional eating that can lead to other comorbid, complicating medical factors associated with depression. So the interest in looking at specific diets has come about, and there also is a link between poor diet and the risk of onset of depression. So there have been correlational studies and some investigation towards specific diets like the Mediterranean diet, which is foods that are rich with monosaturated fats, fiber, and omega-3 fatty acids. However, the evidence for this has been somewhat mixed. Right now, I think the recommendation is to adhere to a healthy diet in order to reduce some of the other medical complications associated with depression. The other area that has shown to have mood benefits and can be beneficial in health, in self-care as well, is the benefits of nature. So studies have shown that in comparison to walking within a city setting, walking in nature resulted in positive mood benefits as well as cognitive benefits. And for those who have talked with me before, I'm often talk about forest bathing and trying to get that program at Lyndhurst, an accessible forest at Lyndhurst. Okay, so as I had mentioned before, there is a particular role between self-care, between stress and depression. And why we talk about this when the role of self-care is stress management. We all know that this is a very important piece of self-care. So the connection between depression and stress is longstanding. Individuals with stress have varying perceptions of stress that are different for non-depressed individuals. People with depression tend to use emotion-focused coping styles, and these are certainly targets when we talk about psychotherapy. There's also association between stressful events and the onset of depression, and as well as your physiological response to depression, so your HPA axis or hypothalamic pituitary adrenal axis. There's long-standing evidence to show that that is dysfunctional and different in those individuals who experience depression. So the importance of stress management is not only important for those individuals with depression, it's important for all of us. And indeed, coping strategies are a focus of psychological intervention. So problem solving, goal setting are essential ways that we control when we're feeling overwhelmed. We certainly teach people how to engage in these strategies. Relaxation techniques are often something that we know can benefit mood and many individuals experiencing many different, different stressors and different issues. And of course, mindfulness, which you'll hear more about, so I'm not going to say anything further about that, but it can be difficult to take the time to incorporate into our lives these types of stress management issues. But I think when we talk about depression, it is a recurrent disorder, as I mentioned before, which can have a greater impact on individuals' quality of life. So it is important to look at positive mental health strategies and prevention. And so in building resiliency. So the importance of the recognition of the symptoms of depression, for early intervention. We know that early intervention is beneficial. And in that it is important that people seek professional help. Well, we know there are limits and barriers within our healthcare system. The help is there and depression is treatable. The other piece is staying connected, so reach out to someone that you trust, and if you are the person that someone has reached out to, we would encourage you to listen with openness and without judgment. So, the importance of managing stress, not only for ourselves and our own self-care, but also for people with who experience depression. One of the cornerstones and powerful practice that can promote positive mental health and manage stress and help with the symptoms of depression and prevent relapse of depression is, of course, mindfulness, and which is why we are talking about this today. It gives me, I'm going to pass this over to my wonderful colleagues that have agreed to be here today. So it gives me great pleasure to introduce the speakers who will be speaking about our mindfulness portion of this event, and another very important self-care strategy. So first you will hear from Angie Kingma. Angie is a registered psychotherapist, certified mindfulness teacher, a faculty member of Toronto's Centre for Mindfulness Studies, and the owner of Mindfulness for Health. And on top of all that, she is also an occupational therapist. So she will highlight some of the neuroscience behind mindfulness, how mindfulness can facilitate the prevention of depressive relapse, and talk us through the foundational attitudes. And later she will share some community resources and how to begin practicing mindfulness in every day. We also have with us Jay Zasulit, a neuro rehab occupational therapist and mindfulness coach who will share her own personal story of recovery from spinal cord injury through a mindfulness-based stress reduction program. So at this time, I'd like to welcome Angie.
All right. So hello, everybody. It is a great honor to be here and to be a part of this amazing event. I won't go into anything about my background because you guys have already heard a little bit about that. And I just wanted to say that even though I have my own sort of performance anxiety, mindfulness has been able to help me overcome the urge to kind of shy away from things like this, and it's helped so many of my clients be able to not only recover from depression, but also to stay well and navigate the ups and downs of life with more skills. So you may be familiar with this famous cartoon. It's sort of on the internet, and you can see here that this fellow is going for a walk in the park with his dog. And although it would seem like it would be a lovely experience, unfortunately, what happens is that his mind is defaulting to this left thought bubble here, which is paying attention to all the things in his life that he has to take care of. So you can see there's a picture of the mail coming in, probably bills, being late for something. He's got this sad face on. There's mismatched socks. All these things that he has to deal with that his mind is paying attention to prevents him from being able to enjoy what's actually happening, which is to enjoy the walk in the park with his dog. And so his mind is, as you see below him, is full of all these stories and stressors. And the dog, on the other hand, lucky canine brain, doesn't have this prefrontal evolution. All he really pays attention to is just what's actually there, just the trees, the sun, and the experience itself. So, which is really encapsulates what mindfulness is all about, which is being aware of what's happening and trying to sort of drop beneath all of this pull towards all the thoughts and problems that we have in our lives that are going on. And so some people might think that mindfulness is sort of a new thing. I mean, it's really exploded in popularity in the past couple of decades anyways, but it's actually been around for over 2,600 years. And it's become quite mainstream now, so much so that it's made it to the cover of Time magazine a couple of times. This was in 2014 when they were talking about this mindful revolution, this sort of population of people who are trying to find more focus, trying to reduce their stress levels, trying to be more present for their everyday moments, and trying to decrease that sense of overwhelm. Also, there's this leading science magazine worldwide called The Scientific American, which was also really highlighting the neuroscience behind mindfulness, and how you can see below here, it's how it changes the brain, boosts focus, and eases stress. And because there's so much science behind this idea, this philosophy and practice, it's really been applied to so many different populations and industries now, such as, I mean, here at hospitals, hospital staff are being trained, a variety of different populations of patients are being trained in mindfulness. Also schools, teachers, students, top corporations, like all of the Google employees are trained. Ford, Aetna, GM. It's really helping coworkers to manage their stresses in the workplace. Lawyers, also top athletes, prisons. Like, you can just hear about it being applied to so many different populations. And so people are being drawn to it for so many different reasons. But then the question is it actually possible to change our brains for the better through meditation? Like, are you kidding me? Meditation? Like, how are we even going to prove that this can change our brains for the better? And so, thank goodness we have all of this modern neuroscience. And the fMRI machines now are able to look deeply into the brain and to see the differences between the brains of, for example, this is a famous monk named Mathieu Ricard. He's been named the happiest man in the world, actually. And this is Richie Davidson. He's done hundreds of studies on meditation and how it changes the brain. And so they look at the brain activity and the brain structures of these, high-level experienced meditators. Then we have, other experienced meditators, but non-monk or Buddhist nun meditators. And then they also look at the brains of people who have taken this famous 8-week training program, which I'll describe in a bit more detail. And then they look at the non-meditators' brains. And they're able to see tremendous amount of quantifiable changes in the human brain that it actually can change and actually can change for the better. So I will be talking a little bit about just highlighting the structures of the brain that have been shown to change with meditation, but just a sort of an overall look at the broad categories of the benefits of our functional benefits in terms of how we feel psychologically, emotionally, how we function in interpersonal relationships, and how we physically are feeling, and also looking more deeply into the physiology behind mindfulness. So psychologically, some of the reductions that have been shown are reduced unhealthy coping strategies or behaviors, reduced stress levels, cortisol levels, reduced anxiety and depression, and increased attention and focus. I mean, who couldn't benefit from more focus? We're also distracted these days. Increased emotional regulation, self-regulation, self-compassion, and resilience. And then in terms of interpersonal benefits, you can see a variety of different sections here. It boils down to this idea that if we ourselves can learn how to develop our emotional intelligence and be more aware of what we're feeling when we're in conversation with somebody, particularly when a conflict is coming up, when we tend to just do the first knee-jerk reaction. If we can enhance our cognitive flexibility and be able to see other perspectives in the situation, express ourselves with focus and with a sense of attunement to the other person, it just stands to reason that it would help our relationships, help us to be a little bit more responsive versus reactive. And so that's really helped me a lot in my own personal life. Although if you ask my husband and my kids, they might think differently sometimes. But overall, it has helped me to really slow down those automatic habits that we would naturally have if we haven't trained in this. Physical pain, it can actually help to reduce the physical symptoms of pain, but how we're also relating to physical pain, glucose and diabetes related to stress. Mindfulness can help improve that area, improve sleep quality. A lot of us could benefit from that, because just when we're trying to go to sleep is when the mind starts to get really busy and replay the whole day over and over and over again. Positive changes with the stress reaction, the physiology of stress. Before I came on here, I was just sitting and trying to work with the physiology and try to be curious about the sensations and really calm the mind's reactions. Improved heart health and blood pressure, and then it's been shown to improve the immunological system. So in terms of the neurobiology of the types of changes that happen through this training of attention, mindfulness has been shown to trigger this positive neuroplastic changes in the brain. So we used to think that as we age, the brain would just simply deteriorate with age. But because of all this brain science, it's actually been shown that we can improve that we can slow down the rate of the age-related changes. And with the 8 weeks of the mindfulness training, it's been shown that how we train our attention can produce very specific changes to the brain. So the limbic system, which for the monks, they kind of light up like Times Square for gratitude and appreciation and bliss and happiness. And again, in 8 short weeks, that part of the brain begins to activate more, to light up and to be more active. Prefrontal cortex, which helps us with attentional control, turning off mind wandering, helping us to problem solve and have self-control, regulation. The prefrontal cortex has been shown to increase in thickness and density in the gray matter. Our amygdala literally shrinks in volume and size, which is responsible for always being on the lookout for stress. So that really reduces in activity. Hippocampus, which is very sensitive to stress and trauma and depression, has been shown to also increase in thickness and in terms of memory and emotion regulation. Temporoparietal junction has been linked with our ability to tap into our sense of empathy and compassion. So they show people images when they're in the fMRI machines, and they can just see when empathy is happening, what parts of the brain light up. And then the insula. So when our mind, the fellow going to the park, when his mind was in that bubble of thinking of all those thoughts, that's the prefrontal cortex, the problem solving. When we're able to move our attention to our feet, our breath, this is the insula that happens, our ability to sense what's happening in the moment. And so I'm not going to go into all the details of these studies, but just to point out that there's a lot of very methodologically sound research to show that a particular program, Mindfulness Based Cognitive Therapy program, an 8-week program, has been shown to reduce the risk of relapse by around 50%. So over and over, these studies show that statistic, and particularly for people who have had 3 or more episodes. So it's pretty fascinating. The second one here is suggesting that MBCT, so mindfulness-based cognitive therapy, has been shown to be kind of on par with when people are staying on their antidepressants. It's been shown to be protective against recurrent depressive relapse. And so we're not suggesting, the disclaimer is we do not encourage anybody to go off their medications, but it's just to suggest that there is some empirical evidence to say that it provides some care against depressive relapse. Other meta-analysis studies, just to show that there's a lot of backing behind this. All of the studies that I'm kind of citing here are based on 2 specific structured manual programs. The first one, Mindfulness Based Stress Reduction. Just by a show of hands, who here has heard of Mindfulness Based Stress Reduction? It's very common. It's evidence-based. It was designed, in 1979, decades ago, to have this sort of 8-week training to help people get in touch with their minds and their bodies in a whole new way. And this course was originally designed for people whose doctors just said, "I'm sorry, we can't get rid of your pain. We can't get rid of your chronic health condition. You are just going to have to learn to live with it." And so people came to this training and they thought, mindfulness, like meditation, how is this going to help me? But again, because of all these decades now of science, it really shows that people help improve their quality of life. And then in 2000, MBCT was born. It's a sister program of MBSR, and it was specifically customized for depression and anxiety, originally depression, but to help people prevent a future depression from happening. And so there's a lot of science behind it, and then it was also customized for relapse prevention from substances, mindfulness-based relapse prevention. So why are people craving these mindfulness programs? You can see here all these people feeling overwhelmed and stressed and multitasking and just drawn to their phones. Can anyone here not relate to some of these? If there's anyone here who can't relate, I want to study your brain after this talk, and I want to find out your secrets. But, our society has never been more distracted. It's such a strong pull to our phones and our digital age and overwhelm of information. And so so we're on the same page. Because it's gone mainstream, it can be kind of confusing. But the most commonly agreed upon definition is this awareness that emerges from paying attention on purpose to the present moment. And it's in a particular way. So it's with these attitudes of non-judgment, with acceptance of what's happening, and it's a kind attention, a compassionate attention that we're trying to really cultivate. Especially it's difficult when something unpleasant is coming up and is experiencing inside of our bodies or in the situation. There's another good definition here, sort of a little bit different, but she says, to notice one's experience with open-hearted, non-judgmental awareness, no matter the nature of that experience. So what she's pointing to here is, by the nature, we mean whether the situation is pleasant or unpleasant or neutral. So having this kind of basic friendliness to all of our moments and not necessarily only going for the pleasant ones. So I like how she kind of adds that into her definition. It is not a religion. You don't have to convert to Buddhism. You don't have to embrace any philosophy. You don't even have to be a spiritual person. It's very pragmatic, really brain training. It's not about needing to feel a certain way. It's not about relaxation, which surprises most people. But it's really just this being aware of what's happening. The problem is that we all have a mind, and when the mind is left to its own devices, it tends to add more stress to our moments. And so the way that it does this, part of the way it does this, is this time travel. This old quote, the past is history and the future is a mystery. This is true, but what happens is when the attention gets sort of pulled into the past, it tends to bring up these themes of regrets, why did I do that, why didn't I do that, anger, why did that have to happen, bitterness, a lot of questioning, why, wanting to understand, and we would tend to overthink it, if only thinking, and has a lot of depression in the past. When it comes to the future, the mind naturally gets pulled into worries. It's uncertain, so we don't really know what will happen, and our brain loves to try to predict and hypothesize, and unfortunately it goes into fears, overwhelm, catastrophizing, thinking worst case scenario, and a lot of the what ifs. And so we don't even notice that we're doing this. We're kind of on this automatic pilot, not even aware that in the background our mind is traveling every which way. So even now, I'm sure your mind, even though you're intending to pay attention, it wanders. And this is normal, and this is just the nature of our mind. And so a big part of mindfulness is learning how to sort of get out of this autopilot mode and disengage from this time travel, to learn how to wake up. And just the foundations that we're training our attention to be more present, but it's in a very particular way. So it's not just spotlight of attention, it's these attitudes, which I'm going to kind of go through one by one really briefly. These are essential when we're practicing mindfulness. Beginner's mind, has anyone heard of this concept before? Beginner's mind, yeah, it's pretty common, but it's this freshness, bringing the sense of curiosity to our moments. Even if there's a sad mood, even if there's anxiety, can we get curious about this? Can we learn how to change our relationship to it? Can we be patient? Patience is an attitude that has a lot of wisdom in it. And we again tend to want things, we want the answers right away. We want to know how it's going to go. And so when things are not the way we want them, we become impatient and we suffer. So mindfulness asks us to practice allowing things to unfold in their own time. And this is difficult. This is not an easy practice to do, but it does get easier with practice. Trust. Learning how to trust our own inner wisdom is a huge part of mindful living. Learning how to let go of our instant snap judgments of, we notice something, we like it, we don't like it. It's a good day, it's a bad day. If a mood, anxiety, depression is here, I don't like this, it's bad. But with mindfulness, this non-judging attitude invites us to drop the label and try it again. If it's here, can we turn towards this? Can we explore this? Can we investigate it? And without the judgment. And then when we notice that we're judging, we just say, okay, don't judge the judging. You just say, oh, there's judging, and see if we can be with the experience as is. It's a little bit confusing at the beginning. Acceptance. So, when we stop the busyness and we learn how to slow down and tune into our bodies, even right now as I'm talking, I'll invite you guys to feel your feet on the floor, feel your breath. If something challenging is coming up, whether you're feeling impatient or bored, or if there's pain that's present, can we practice this allowing and accepting, even if it's unwanted? Non-striving is a thing where we're constantly wanting things to be, we're working on goals, we're changing, we're fixing. Non-striving is letting go of expectations, right? Just having a moment of just letting it be as it is. And it gives us just a balance between our usual striving mode, which is not bad. It's just that it can be unhelpful when it comes to the inner landscape. And then the last attitude that we're practicing is this idea of letting go. So with depression and anxiety, we get pulled up into these stories of harsh self-judgment, and again, this time travel. And we're trying to, if we're getting pulled into unhelpful thought loops or rumination, can we let go of the thoughts, and can we refocus our attention on what's happening? Can we use our breath? Can we use our body? Can we let go of the wanting things to be a certain way? And as we transition to our next speaker, I'll encourage you guys to see what it's like if you can let go of all the stuff that I just said. So just letting go of all those words and all those concepts. And Jeza Sulit, she's going to share her story with us and then guide us in a practice.
Good afternoon, everybody. Happy to be here. Thank you for joining us virtually and in person. So I'm a mindfulness teacher. I teach the Mindfulness Based Stress Reduction program, as well as the Mindful Self-Compassion program, which I guess we could call the cousin of MBSR and MBCT. So how did I get here to share mindfulness with you? Well, I am also a neuro rehab OT, and I did that for about 5 years. Until then, I began to learn about neuroplasticity and the amazingness of this physiological function we have when I became a patient. So I actually had a motorcycle accident in 2010. And so in a nutshell, I lost control of the motorcycle, accelerated into a curb, was thrown into a fence, landed on my head, and sustained burst fracture of the 12th thoracic vertebrae with 60% spinal cord compression. So I had incomplete paralysis from the waist down and told that I would never walk again. Now, fortunately for me, I made some progress in the first year, progressed from a wheelchair to a walker to 2 single-point canes. But despite that progress, at the 1-year anniversary after my accident, that's when I started to experience the mental health challenges, so specifically anxiety and depression and grief. So some factors that contributed to my mental health challenges was this new reality of living life with chronic pain and fatigue, leading to physical and functional limitations, in particular, not being able to go back to work or doing the things I used to do with my friends, especially the physical activities like Filipino folk dancing and snowboarding and running. Also for me, and I know I'm not alone, many of you can probably relate to this, where my sense of self-worth was conditional upon working, doing, achieving, on being productive, ticking off your to-do list. And so with less doing, I actually felt less worthy of my own acceptance. And for me, I had a long habit of repressing particular emotions, in particular, grief, shame, and anger. So at that 1-year mark after my accident, I decided to take the Mindfulness Based Stress Reduction program. And the main things I took away from that 8-week program was that, mindfulness is actually a lifelong daily practice in responding to every moment for the rest of your life. And I also learned that it's not about what you do, it's how you do it. And those hows are those foundational attitudes that Angie talked about. And so it doesn't matter if you're going to meditate for 10 minutes every day, and I do yoga 5 times a week, if the whole time you're doing it with judgment of yourself because you can't let go of expectations of how you have to be, how your mind has to be. So it doesn't matter what you do, it's the how. And that how is a turning towards your experience, no matter what the experience is. So really, mindfulness is learning to be in a relationship, a particular relationship where we have an open mind and an open heart to experience what's here. And so, out of those 7 attitudes that Angie talked about, these were the 3 attitudes that helped me specifically in terms of coping with anxiety and depression. Non-judgment helped me to stop shitting on myself. So stop shitting on yourself. Should is what I'm saying. So, I was like, I shouldn't feel angry. I shouldn't be sad because I should be happy and I just should be grateful that I'm alive. And all of this shoulding on myself led to me layering on the mask of smile and be happy and everything is good. Acceptance. I love the image of the welcome mat because acceptance reminded me that, Jasa, you're allowed to be human, and to be human is to feel everything. Give yourself permission, at least a minute, an hour, to be sad, to be angry, to be frustrated, to be irritated, to feel all those feelings, at least for me, the unpleasant feelings, I repressed. I swept under the rug of gratitude. So gratitude is great, but I used it as a rug to sweep certain emotions under. So acceptance allowed me to give myself allowance to feel and express these emotions. And then finally, beginner's mind, or simple curiosity, curious interest. Instead of ignoring emotions that I don't want to feel, curiosity reminded me to turn towards this experience with an interest to maybe learn and discover something so that I might understand something new that will help me to move forward to feel better. Now, before mindfulness, I didn't even know that I wasn't happy because I was too busy and distracted to acknowledge what I was feeling inside. And the problem with that is when I was not aware that I was suffering emotionally, then I could not give myself compassion. Because compassion involves a sensitivity and awareness to your experience of suffering coupled with a deep desire to alleviate that suffering. So if I'm not aware of that I'm even struggling, then I can't practice compassion. And that's why I put the image of a bird with 2 wings, because we can't fly with just mindfulness. We need compassion. And that compassion has to begin with yourself. Self-compassion, which is compassion directed inward, relating to yourself as the object of your own care and concern when you're facing suffering. It involves your capacity to comfort and soothe yourself, to motivate yourself with encouragement when you suffer, fail, or feel inadequate. And together, mindfulness and self-compassion, that lays the foundation for a self-care practice to grow. So for example, with mindfulness, I became aware that I was really struggling emotionally, and with that self-compassion, that desire to feel better, when I started having suicidal thoughts returning into my life, I went straight to my physician. I said, I need help. So it's because of mindfulness and self-compassion that I referred myself to CAMH. I saw a psychiatrist, got assessed, got diagnosed, and I got referred to all the different therapies I needed that has helped me learn to cope with anxiety and depression since. So basic message is mindfulness alone is not enough. Mindfulness opens the door so that we can then also develop a self-compassion practice. And so speaking of practice, let's take a few minutes, just 3 minutes to practice. And just a heads up that because we're going to pay more attention to ourselves, you're going to notice both pleasant and even unpleasant things, physical, emotional sensations. But just remember and trust that mindfulness is not making your pain worse. It's just having us be more aware of what's here. And also remember that you are always in control of your own attention. So practice self-care, and remember, you pay attention to what you want, when you want, for how long you want. So you can ignore my guidance and put your attention on what you're looking at, breathing a part of your body. You listen to your own needs. So with that, getting into a comfortable position. You can have your eyes gently closed, or if you want to look at the ground in front of you. And let's, in our mind, lay that welcome mat out before you. May this welcome mat remind you to open your mind and heart with the openness of curiosity, friendly acceptance. With patience and trust and letting go of how you need to feel, be, or do. And with this curious, kind acceptance, just bringing your attention to your legs and feet, noticing how your legs and feet feel. What about your hips, buttocks? Curiously bringing your attention to your torso, your belly and chest, and your entire back. And then scanning your shoulders and both arms and hands. And then moving your attention to your neck, face, and the rest of your head. And then expanding your awareness so that you're aware of your whole body now. Sitting or standing or lying, from head to toe. Just putting your welcome out for your body to be as it is right now. And if you notice your mind wandering away, if you have a mind, it will wander. So no judgment. Gently bring your mind back to the body. And then we'll move on to putting the welcome mat out for your emotions. Have you asked yourself yet today, how am I feeling? So I invite you to ask yourself, how am I feeling right now? And giving yourself permission and allowance to feel whatever is here. And it helps often to label your emotion. Worried, relaxed, stressed, irritated, nervous, all welcome. And then finally, let's come to the breath. Maybe you notice it in your nose or throat, chest or belly. Noticing how your breath is always unfolding in real time. Always fresh, always new, and that's why it is an amazing tool to use to anchor your mind to the here and now. This inhale, this exhale, always fresh and new in the now. And finally, we'll move on to a self-care step, asking yourself, what do I need? What would I love to do for this evening, this afternoon? What do I need for myself this weekend? What does my body need, my mind need? And if this is your first time asking yourself this, sometimes answers don't come up, so I encourage you to repeat this question every day. What do I need? And then visualizing yourself doing that which you need. And finally, taking a final few breaths, thanking yourself for taking this time to nourish your body and mind as you have. And if you have any comments or questions, take note of that, and we can address them during the Q&A after this. When you're ready, you can open your eyes as we continue to the conclusion of our talk.
Thanks, Jeza. That is the best way to learn and benefit from mindfulness is through the practice. So then there's a few resources here. I mean, because I'm on faculty at the Center for Mindfulness Studies, we have a whole whack of programs. I also wanted to mention the one below there, Mindfulness Toronto, mindfulnesstoronto.net. They have a collection of all the resources in Toronto. There's lots of other programs in Toronto, so feel free to go to that as a resource. And then the last thing is, number one, when possible, just do one thing at a time. Number 2, pay full attention to what you're doing. Number 3, when the mind wanders, gently bring it back without judgment. Number 4, repeat step 3 several billion times. And then number 5, investigate your distractions. Be curious about them. All right. And then there's a bunch of apps. I'm sure you guys have your favorite ones, but those are just some great ones. All right. And then there's some resources here that, Martha, did you want to talk about them? Or you can just take a look here. There's all the resources in the city.
Thank you, Angie and Jeza, for a wonderful and insightful discussion regarding mindfulness. I think we're going to move to the question and answer portion of this. So if you want to join me over there. Okay, so the first question, is this from somebody who emailed in? Yes. Okay, so people have been emailing in our questions during, while we've been speaking. So how does one sign up to the Mindfulness Stress Reduction Program?
So I can offer one suggestion is to go to the Center for Mindfulness Studies website and then contact them and let them know that you're interested in the MBSR program. They're a nonprofit organization, and so anybody can take the training regardless of income. We offer bursaries for people who can't afford them. Do you know of any other MBSR?
Yeah, if you just Google Mindfulness Toronto, you'll find a site called Mindfulness Toronto. It's an organization here in Toronto, and they actually meet monthly at Mount Sinai. But just look for a tab that says Programs, and it'll show you all the people who are teaching MBSR in the GTA.
Okay, do we have another question? Yes? Yes.
Can I get a mic? Yeah, sure. Okay, so what would be the most effective number of times you should meditate, and for how long?
Yeah, that's the most commonly asked question. How little do I have to meditate to get the benefits, basically? So in terms of the data and the literature, all of the brain changes that I mentioned, they're part of that 8-week program where people are invited to commit to 40 minutes a day. So, but there was a study by Sarah Lazar who the participants averaged 27 minutes, and they still got those benefits. But there are some teachers and students who say that even 10 minutes a day can have a very subjective, improved quality of life. So I tend to err on the side of just start with what you can. Like even if you just start with taking a breath, one breath from time to time, just carving out this new habit of checking in and tuning in. And if it's only 1 minute you can do, then I think that's a great start.
I think we have another question over here.
I have a question. So I work in conjunction with like an outpatient program, and we do relaxation strategies, but for the clients who are not psychologically minded, who are not ready to accept that this might potentially be beneficial to them, how as clinicians can we gradually introduce this topic? Like, is there any benefit in having them try to participate in these exercises even if they're not acknowledging that they could be beneficial? What do we do?
Okay. Just the first thing is, so you're doing relaxation strategies?
Yeah, so we do progressive muscle relaxation, some visualization exercises, and I think the program is trying to introduce like mindfulness-based concepts, but we have a lot of people who have chronic pain, which mindfulness can be beneficial for, but they're not really acknowledging the psychological aspect. And so we're trying to introduce these topics, but for the clients who are not ready to accept that this is a potential source of benefit, how can we introduce it?
So the relaxation strategies like progressive muscle relaxation, they have an intention and a goal to try to help the nervous system relax, whereas mindfulness is more not striving for a particular state, like not trying to get relaxed or trying to get calm. It's more just helping them to be aware of what's happening as it's happening. So perhaps starting, I like Jay's instructions at the beginning, which were, you can do what you want. You can drop underneath these instructions if you don't don't want to pay attention to the breath, you can focus on something external, like look at the clock. So maybe just giving them a variety of different options for those of them who might not want to like turn inward, giving them options that they can focus externally if they want to. But I still think like planting those seeds might be beneficial for them even if they don't want to be doing it.
Jayza, did you want to add?
Yeah, I'll just add, a simple way to sell or market mindfulness is just take it back to the fight or flight. Most people understand fight or flight, freeze, fight or flight versus relaxation. And so just taking it back to how does mindfulness play that role in helping us move into relaxation mode, and how does that decrease pain? So that's, changing the neural pathways way seems to be a sell for. Yeah, give them the evidence that it can change your neurophysiology, and that's, I find, an easy buy-in for a lot of people.
Thank you, Angie and Jayza. We too struggle with that as well. I run some mindfulness and relaxation groups, and getting people to buy in can be, so that's helpful information. Thank you very much. Yes, do we have another question?
Yeah, so thanks to all three of you. I learned so much, and Jayza, I especially love the idea of each breath being fresh and new, and it's like a new start every time you take a breath. My question is there ever an instance when meditation wouldn't be recommended for someone?
So yes, particularly for people who have had a history of trauma, it can be, the breath is not neutral for everybody. Sometimes turning the attention to the breath can actually be very triggering in terms of bringing up traumatic memories involuntarily. And so for most mindfulness teachers, they're called upon to become knowledgeable of how to modify the practices for trauma. So, and offering different suggestions, like you don't have to pay attention to the breath. You can pay attention to your feet. If you want to keep coming back to your feet, that's okay. So yeah, so history of trauma is definitely, we're really careful with the meditations, and especially like prolonged, like 30-minute meditation, we wouldn't recommend right at the beginning. And then also, do you have any contraindications for mindfulness? I think that's the big one, trauma.
Yeah, trauma, history of suicidal attempts and substance abuse. So it'll be case by case, but that's something that we would work out with every person.
And then the last one, also history of psychosis. Again, we would want meditations that were more grounding, and not so much the insight meditations where we're expanding our attention. We'd more grounding and stabilizing meditations.
Thank you. Okay, so we have a question that was emailed in. Is there a place I can visit online to find mindfulness-based stress training in my area? So is that part of some of the websites that we had posted earlier?
Yeah, so particularly for Toronto, there's a huge community here in Toronto. So Mindfulness Toronto coordinates all those. I'm in Milton and Peel, so I coordinate all the Mindfulness Halt and Peel resources. We have a professional, like a Mindfulness Halt and Peel group where we meet every other month. So if you Googled that, I'm sure people could find resources there. Yeah, just Googling is usually the best idea to find resources.
The benefits of Google. Yes.
So could you equate prayer to mindfulness meditation?
So Arlene's question is, can you equate prayer to mindfulness meditation?
That's a great question. I am not a specialist in that area, but my first thoughts are that with prayer, I guess we're sort of, the similarities are that it's sort of in solitude, it's an inward focus, perhaps done in a quiet space. And then with prayer, perhaps we're more connecting with our deity or our God. We're speaking to them, maybe reciting some words and sentences. So there's kind of like a goal where your goal is to connect and get maybe strength and inspiration. Whereas with mindfulness meditation, we say that there's no goal in particular. So the intention would be a little bit different. So I think that would be the difference. But a lot of my clients who have trained in mindfulness meditation have commented that when they are doing their prayers, whatever the religion or philosophy that they follow, they can be more present when they are actively engaged in their prayers. So they can kind of go hand in hand. And they say that mindfulness can help you be more of what you already are. but you don't have to be spiritual.
Thank you. So the question that has been, are there foods that promote happiness? So that's probably in relation to my discussion about
Chocolate.
Actually, they have actually looked at studies looking at chocolate and how that promotes activity within our reward system, as you may not be surprised about. So with respect to various types of food in terms of happiness versus looking at whether or not they help with mood and with depression, I think based on the literature that's out there, a lot of the information regarding specific diet and mood is really correlational at this point. In some of the studies that have looked at specific diets, mostly healthier diets like the Mediterranean diet, they have produced mixed results at this point. So I think the general recommendation with respect to food, can food be used as an intervention for the treatment of depression? Not at this time. However, we do know that adhering to a healthy diet, as mentioned previously, it's beneficial for our overall health for anyone in here, as we all know, and many struggle with, but also can help with the various complications associated with depression, like the metabolic disturbances and things like that. So reduction of those complications can be helpful, which is why it is recommended that individuals stick to a healthier diet. All right.
Depression is a recurring condition. What if you have seasonal depression? And because often, like I've seen my clinician and they say, oh, it's just seasonal depression, just and that's all, you just go through the season and get some sun and take some vitamin D. What recommendation would you provide for that?
That's a great question. There are various treatments for the different types of depression. So with seasonal depression, seasonal affective disorder, there are individuals who specialize in that, and you could probably see those in consultation. But light therapy is also a well-known treatment for seasonal depression. So whereas, a typical recurrent depression that maybe doesn't have a seasonal pattern, other types of interventions might be appropriate, like medication or therapy. Seasonal light therapy is specific to that.
I'm just going to conclude this session. Thank you very much for joining us. Thank you, Martha, Angie, Jeza. This has been a fantastic session. I know all of you benefited from it, and hopefully you'll be able to leave this and use mindful meditation as part of your daily practice. I just want to remind you a couple of things. So please remember, tomorrow is Bell Let's Talk Day. Bell has contributed well over $100 million to organizations across the country, really supporting the delivery of a number of mental health services. And we can all be part of that and help to grow that opportunity for these charities. Every time you hashtag Bell Let's Talk, if you have a Bell phone, they will be donating 5 cents for all of us who view the official Bell Let's Talk Day video on Facebook, Instagram, or Twitter. You'll also get help to contribute 5 cents for every view. And you also, they will also do that for viewing this on Facebook, doing the hashtag on Facebook filter or Snapchat filter. But I encourage you to visit the Bell Let's Talk site to get more information. We are also have a couple of things that we're going to hand out today. So Jeza, as you know, is an author. She has an award-winning Amazon book called Purpose in Paralysis. So we are going to be picking 2 members of our online viewers, and they will be winning this, and we'll be reaching out to you about that. And we also have 2 people in the audience here who will get a book. So if you take a look on the left arm of your seat, if there's a little sticker, you are a lucky winner. So I just wanted to thank you again for joining us, and here's some information about Bell Let's Talk. This webinar is being recorded. It will be made available in about a week's time, and we will be sending all the viewers the link. So keep an eye out for that, or you can visit healthinnovationseries.com. And please remember to sign on to book the date for Tuesday, March 31st. We'll be doing a session on a recipe for success, looking at all different types of food diets. I think that'll be helpful for several people. And in May, we'll be doing something around exercise. So thank you again to our generous sponsors for enabling this for us and for the community and people globally. And have a wonderful day. Thanks. Bye-bye.